All right, today we're going to play medical detective. Our case kicks off not with a crime scene, but with one single mysterious clue from deep inside the body, an enlarged liver. So let's get this investigation started.
So this main clue of ours, it has a fancy medical name, hepatomegaly. Now, this isn't a disease all on its own. You should think of it more like a signal flare that the body shoots up. It's this big, bright sign telling us, hey, something's up in here. And that's what gets doctors to start digging.
Okay, let's examine our first piece of evidence. Now, an enlarged liver itself, that might get picked up during a physical exam, but it's usually the other symptoms that it brings along for the ride that really sound the alarm.
But here's the tricky part. These symptoms, losing weight, not feeling hungry, just feeling wiped out all the time, they're super common, right? They could point to almost anything. And that's exactly why when you see them pop up with an enlarged liver, it tells doctors they need to look way, way deeper.
And that brings us to our list of suspects. And trust me, it is a long one. An enlarged liver can be caused by a huge range of different things, which turns our one simple clue into a really complex puzzle. I mean, just look at this list. This really shows you the challenge. The cause could be an infection, like a virus attacking the liver. Or it could be something neoplastic, like a cancer. It might be biliary, which has to do with things like cirrhosis scarring the liver. Or it could be metabolic, like fatty liver disease, which is often tied to our lifestyle. Heck, even drugs, especially alcohol, and conditions you're born with, like sickle cell disease, are on the suspect list. So with a lineup of suspects this long, where in the world do you even begin? Well, to really get a feel for the process, we're going to follow the evidence for one very common culprit. Let's open up the case file. Our prime suspect is infectious mononucleosis, which is usually caused by the Epstein-Barr virus. You've probably heard of it by its much more famous nickname, the kissing disease. Let's see if the evidence holds up. Before we start digging through the evidence, a little history is always good. Our understanding of this illness took decades to come together. It was first spotted back in the late 1800s and called glandular fever. The much more sciencey term, infectious mononucleosis, wasn't created until 1920. But get this, the actual culprit, the Epstein-Barr virus, wasn't identified until 1964. And how does this thing get around? Well, the main way is person to person, through saliva. This is exactly why it's so common in teenagers and young adults. And of course, how it earned that unforgettable nickname, the kissing disease. All right, every good detective needs solid evidence. So let's take a look at the classic, telltale signs and symptoms that make doctors start thinking, this could be mono. The case for mono is usually built on what's called the classic triad. First up, you've got a fever. Second, tonsillar pharyngitis, which is just a fancy way of saying a really, really bad sore throat. And third, lymphadenopathy, or swollen lymph nodes. When these three show up to the party together, mono gets bumped right to the top of the suspect list. And wow, this image really shows you what that severe sore throat can look like. This is not your average scratchy throat. We're talking about some serious swelling of the tonsils, and they're often covered in these thick white patches. For a doctor, this is a huge piece of visual evidence. And here's another key clue. With mono, the swollen lymph nodes are most often found in a specific spot, the posterior cervical chain. That's the group of nodes right along the back of your neck. It's another one of those specific signposts that points investigators straight towards a monodiagnosis. Now, in up to about 45% of cases, another piece of evidence might show up, a rash. It's usually got both flat and raised reddish spots, and it tends to pop up on the trunk and arms. It's not there in every single case, but when it does appear, it definitely strengthens the case against mono. Now, remember how this whole investigation started with an enlarged organ? Well, it turns out that about half of all people with mono also get an enlarged spleen, which is called splenomegaly. This happens because the spleen is a major hub for your immune system, and it swells up with all the infection-fighting cells it's making. It's kind of like a close cousin to our first clue. And this brings us right back to where we started. In about 10% of mono cases, the patient develops hepatomegaly, an enlarged liver. Just like the spleen, the liver can get inflamed because it's working overtime, helping to filter the blood and playing a role in the immune response. So that mysterious clue we started with, it's a known, documented feature of our prime suspect. The case is really coming together now. So we've got a strong suspect and some really compelling evidence. Now, let's look at how doctors actually confirm the diagnosis and what the road to recovery looks like. Confirming the diagnosis is a step-by-step process that moves from just looking to the lab. After a physical exam, a blood test will often show a really high number of white blood cells called lymphocytes. More specifically, doctors are on the lookout for what are called atypical lymphocytes. If those make up more than 10% of the total, that's a huge red flag for mono. And finally, there's a quick screening test, the monospot test, that can spot the specific antibodies fighting the virus. Okay, so once the culprit is confirmed, how do you beat it? Well, since mono is caused by a virus, antibiotics won't do a thing. The treatment is all about being supportive, which basically means letting your body's own immune system do all the heavy lifting. The patient's job is just to help that fight along with tons of rest, fluids, and good nutrition.
Now this right here is maybe the single most important piece of advice for anyone getting over mono. Remember that enlarged spleen we talked about? It's really fragile while you're recovering. Staying away from contact sports is absolutely crucial to prevent the risk of it rupturing, which is rare but life-threatening.
So let's just step back and connect all the dots. We started with this one little clue, we followed the evidence, and we arrived at a clear diagnosis. We've solved our medical mystery. This table just sums it all up perfectly, doesn't it? Our clue was the enlarged liver. Our prime suspect was infectious mononucleosis. The evidence was that classic trio: fever, a terrible sore throat, and swollen glands. And the resolution? Supportive care, with that critical advice to rest up and stay away from contact sports. A classic case of medical detective work closed. And that solves the case of the enlarged liver. It's a perfect example of how one vague sign can lead to a very specific diagnosis. And it's a great reminder that our bodies are sending out signals and clues all the time. The trick is to listen and to know when it's time to bring in a professional detective, your doctor, to figure out what they mean. Thanks for joining the investigation.